everyone, my name is Jillian Parker, and over the next couple of months we're going to be rolling out a series of videos answering a lot of questions that the community has about the flu, about COVID-19, and about the overlap of it being flu season with the COVID-19 pandemic continuing. Today, our first segment, we're joined by Tatiana Timkiff. She is the Executive Director of Employee Health Services and the Wellness Department. And Tatiana, thank you so much for joining us, first of all. Now, aside from the pandemic and COVID-19, why is it important in any year to get the flu vaccine?
Thank you for the question, and thank you for having me here, Jillian. So, flu vaccination is the first and most important step in protecting against flu viruses. Therefore, everyone 6 months of age or older should get flu vaccination every year. Children that are younger than 6 months are at high risk of developing serious illness from flu, but they are too young to get vaccinated. Therefore, people that are taking care of infants should get vaccinated instead. Also, it's very important for healthcare workers to get vaccinated, and those people that live with or care for people that are at high risk to get complications from influenza.
And now this year, obviously we have a unique situation with the COVID-19 pandemic. So does the fact that we're still dealing with the pandemic make it even more important this year to get the flu vaccine?
Absolutely. Well, flu vaccine cannot protect us from getting COVID-19, but it can help to reduce the number of sick people with flu-like symptoms getting to hospital and placing burden on healthcare providers, and also to preserve our resources that we would need to take care of patients that if they're going to come to hospital with COVID-19 symptoms.
Is there anything that people with underlying conditions should know? They're at a bit of a higher risk about going in to get the flu vaccine.
Absolutely. Pregnant women, elders, people with underlying health conditions, they have to get flu shot every year because, as I said, they're at very high risk of developing complications from getting flu. Therefore, it's critical for them to remember that every year, and especially this year, they have to get flu vaccine.
Now, I think a common question that we often hear from the community is, can I still get the flu after I get the flu shot? So that is my question to you.
Unfortunately, yes, you can get flu. And there's multiple reasons why you can get flu even after you received your flu shot. You might be exposed to someone with flu virus before even you got your flu shot. Also, it takes time for flu vaccine to start working in your body. It takes up to 2 weeks for your body to develop antibody to those few viruses that flu vaccine would cover. So during that period of time, you can, if you was exposed to someone with flu, you can start developing flu symptoms.
So there was a study released not long ago that said that 1 in 3 parents were not planning to take their kids into the doctor's office to get a flu shot this year. And there were a few reasons for that, but the main reason was fear of bringing their kid into the doctor's office. So my question to you is, why should the community feel comfortable bringing their kids to the doctor's office with the safety measures that were taken?
Community should absolutely feel comfortable by bringing their children to doctor's office or coming to doctor's office if they need help. We all use personal protective equipment. The office is cleaned multiple times, disinfected multiple times during the day.
And I know it was a concern from a lot of people in the healthcare industry that so many parents were deciding not to bring their kids in to get the flu shot, especially this year during the pandemic. And I think one of the other reasons was people fear that they will get the flu from the flu shot. And there's a lot of misinformation that's spread online when it comes to the flu vaccine. How can you respond to people thinking that getting the flu shot means they're going to get the flu?
Very good question. When you're looking into research and the articles that being published by experts, you definitely cannot get flu from getting flu shot. There's no way you can get flu from getting flu vaccine.
Tatiana, thank you so much for joining us, and we're going to continue to roll out more videos in the coming weeks, again, as I said, talking about COVID-19, talking about the flu symptoms, how they are similar, the overlap of the two this coming flu season. We will get to all of those questions in the coming weeks. For any additional information, please visit our website at Rochester Regional Health and our social media channels. Thanks.